Well, thank you very much. And I see Senator Mendoza would be here to present SB 792. Senator, as be item number 10.
Thank you, Mr. Chair, members. 792. First, I would like to accept the technical amendment outlined on page 7 of the analysis. Second, I would also like to offer an amendment as presented in the mock-up, provided that ensures noncompliance with the provisions in this bill, that ensures that noncompliance with the provisions in this bill will not be considered a crime. And that's and I want to thank your staff for working very closely with us to making this bill just a much better bill. SB 792 protects young, vulnerable children from making sure that those who care for them in child care settings are vaccinated against serious contagious illnesses. While diseases like the measles may seem like a minor inconvenience for you and I, it can be deadly for young children. Numerous expert bodies, including the CDC and the California Department of Public Health, recommend that those who care for young children receive a measles shot and other important immunizations. Until they are fully vaccinated, children rely on those around them to maintain a community of immunity. This bill will affect employees at daycare centers and family daycare homes and was carefully crafted to place these requirements within existing laws governing the daycare centers. All of the vaccines required by this bill are covered in full at no cost to the employee by insurance policies and Medi-Cal. Uninsured employees can find no or low-cost vaccines at their local health department. Employees can obtain a medical exemption from their physician if they cannot be vaccinated or if they can show that they've already been immunized. The immunization records will be reviewed during regular licensing inspections along with other required records such as TB screening results. We worked to make sure that this bill was minimally burdensome to the providers, including recent amendments to scale the bill back with just a few vaccinations. With that, we do have a few speakers in support.
Thank you. Please proceed.
Good afternoon, Mr. Chair and members. I'm Dr. Robert Kim Farley, and I'm testifying on behalf of the Health Officers Association of California and also representing Los Angeles County. By way of my background, I am Director of Communicable Disease Control and Prevention for the Los Angeles County Department of Public Health. Every day, parents throughout California entrust the staff of daycare centers to keep their infants and children safe. By requiring child care staff to be vaccinated, we can help prevent the transmission of vaccine-preventable diseases to these children. SB 7092 has been narrowly focused to require staff of daycare centers to be fully vaccinated against 3 highly contagious yet preventable diseases: measles, pertussis, and influenza. This bill protects infants and young children who are too young to be immunized or fully immunized, are more likely to be susceptible to those contagious diseases, and are more likely to develop serious or life-threatening complications should they become ill. Last year in California, over 450 people were hospitalized due to pertussis, 2/3 of whom were in infants under 4 months of age, and sadly, 5 of those died. Measles, pertussis, and influenza are easily spread in the daycare center environment. For example, there's a 90% chance of being infected for an unvaccinated person who is in close contact with a measles case. In addition, all 3 of the diseases are transmissible before a person shows symptoms. It is also important to point out that the environments of daycare centers are vastly different than the environments of healthcare facilities. Hospitals and clinics are required by laws and regulations to have a variety of highly sophisticated infection control programs in place to help prevent the spread of disease, not only for the patient's safety, but for the hospital personnel as well. Daycare centers, no matter how clean, do not have those same precautions in place, nor should they. But vaccinating daycare center staff against measles, pertussis, and influenza can help stop the spread of those diseases to their fellow workers and, most importantly, to the infants and children in their care. Finally, I want to emphasize that SB 792 allows physicians to use their best judgment when recommending vaccines for their patients. Daycare workers who have medical contraindications to any of these vaccines would not be required to receive them. For example, daycare workers who are pregnant or plan to become pregnant would not be required to receive the measles vaccine, which is contraindicated during pregnancy. Throughout the decades, it's been scientifically proven that vaccines are safe, effective, and the best way to prevent diseases. Yet many adults forego vaccinations, which can be beneficial not only for their health, but for those around them. Having served as the director of the World Health Organization's Global Immunization Program and personally witnessing the tragic consequences when children are unvaccinated against preventable diseases, I urge your aye vote on SB 792 to protect the health of infants and young children in daycare centers. I'm happy to answer any questions that you may have.
Thank you.
Chairman Chu and members of the Assembly Human Services Committee. My name is Arlene Garcia, and I'm the Center Director at Vintage Park KinderCare in Sacramento. Thank you for the opportunity to come before you today in support of Senate Bill 792. KinderCare is a brand of Knowledge Universe, which has been serving children and families for over 40 years. Our other brands include Children's Creative Learning Centers, our employee-sponsored child development centers, and Champions and after-school program. We have 181 community-based centers across the state of California, employing more than 3,700 teachers and staff. As you are well aware, earlier this year, the U.S. experienced a multi-state outbreak of measles, with 178 cases documented between January 1st and March 27th this year. Infants who are too young to have received their first MMR vaccination are especially vulnerable to contracting measles. At one child care center alone this year, 12 infants became sick with the measles as this highly contagious illness spread from one infant to all other infants in the center. Given the close contact between child and caregiver and the vulnerable population child care providers serve, it seems prudent that the child care workers be immunized, much like our counterparts in healthcare who work in close contact with vulnerable populations such as infants. We at Knowledge Universe have recently instituted a policy requiring staff to be vaccinated for measles and have restricted access to our infant rooms to individuals who have been vaccinated and parents alone only. We have instituted this policy in all 39 states in which we operate and in the District of Columbia. We believe Senate Bill 792 will go a long way in protecting infants who are too young to be vaccinated from contracting vaccine-preventable diseases. We urge you to pass this important legislation and would be happy to answer any questions that you may have.
Thank you.
Thank you. Mr. Chair and members, my name is Kat DeBerg. I'm the Executive Director of the Health Officers Association of California. We want to thank the author and the committee for excellent work on this bill that is all about protecting children in the daycare environment. Every child under the age of 5 is at increased risk for the illnesses listed in this bill, and at increased risk of complications if they do catch those illnesses. And each of these illnesses, as Dr. Kim Farley mentioned, is contagious before symptoms are shown, which means that calling in sick is not enough. That's why we sponsored the bill and urge you to vote aye. Thank you.
Great, thank you.
Mr. Chair and members, Bron Shea Jones on behalf of Knowledge Universe and our nearly other 200 centers in strong support.
All right, great. Any additional support witnesses, please come forward.
Good afternoon, Mr. Chair, members of the committee. Ron Rapp on behalf of the California Federation of Teachers, speaking in support. Thank you.
Thank you.
Betsy Armstrong on behalf of the County Health Executives Association in strong support.
Thank you.
Amy Alfieri, parent of 2 small children, West Sacramento resident, and I'm a volunteer with Vaccinate California as well, in strong support. Thank you.
Yeah, thank you.
Lydia Bourne, representing American Academy of Pediatrics, California Division. We are in strong support of this bill.
Oh, great, thank you.
Nicole Wortelman on behalf of the Alameda County Board of Supervisors in support.
Thank you.
Justin Garrett with the March of Dimes in support.
Thank you.
Alicia Sanchez representing the California Medical Association and our over 40,000 members in support.
Thank you.
Latoya Ramsey, National Association of Social Workers, California chapter in support.
Thank you.
Mr. Chairman and members, Michael Radigan on behalf of the Board of Supervisors, Santa Clara County in support.
Thank you.
Jody Hicks on behalf of the California Academy of Family Physicians in support.
Thank you. Any opposition? Please come forward, and we'll allow 3 to speak, so please take a seat up in the front.
You can just come back when they're done.
No, I'm not in opposition. I'm a tweener.
All right.
Good afternoon, Senator.
Thank you.
I'm Dion Aroner here on behalf of the Service Employees International Union, who's organizing family child care providers who are licensed by the state of California. There are 32,000 of them, and we are not in opposition to the bill, Mr. Chairman, but we have some concerns that we would like to share with the committee.
Please.
And we've been in contact with the author, who's been very gracious to spend time with us in trying to figure out how to meet the concerns of these 32,000 family providers. We're not talking about child care centers from this perspective. The average age of a family child care provider is around 50 in the state of California. And according to your analysis, 94% of them are already immunized. So the issue is not are they immunized or not, and we have no problem, no issues with immunizations. The problem for us is how do we prove it to somebody that someone's been immunized when it's been many years ago? I can't prove that I've been immunized, right? And I was born and raised in San Francisco, and I can't, and I'm older than 50. And so the question for us is one of the proof of it, right, and how much it would cost to do that, let alone if someone had to be re-immunized. According to your analysis, it's around $150 to be able to meet that. These are individuals who make on an average between $7,000 and $15,000 a year. We've computed it out to be sometimes at $4.98 an hour. And so it is not, it's too easy to say that it would be easy for them to take care of the problem. They just can't. I have no idea how much the titer tests would cost. No one's given us a cost factor on that. But it's an issue here. If the state wants to mandate something, then we need to figure out a way to pay for it, right, let alone to prove it. So we made a suggestion to the author around doing posting, right? Child care homes are a very interesting model in the community care licensing world. And that's because as opposed to the adult world, where very often nobody comes to see an adult, right, in a long-term care facility. In children's centers and in family child care homes, parents come in twice a day. All right, they are the best actually regulators of a family daycare program than anybody else. The state visits on the average of once every 39 months right now. They're only required to visit once every 5 years unless there's a complaint filed. And so what we're suggesting is to turn this into an education bill from the perspective of educating parents as well as providers as to the importance of immunizations. We believe in immunizations, but we're trying to figure out a way to administer this that is fair to both the providers and to the state in trying to figure out how community care licensing, who can't make an annual visit yet and is not planned to make any annual visits in the children's world, because the governor's only aiming at once every 3 years. And so we were suggesting to the author that possibly a posting, because that way you involve the parents, who you want to have educated, be able to ask when they go into a provider's home to say, is everybody immunized here? I have to admit to you, I'm a user of family daycare, right? Both for my children and now my grandchild. I did not ask our family daycare provider, is she immunized or is everybody else immunized? It's a wonderful thing to tell parents that and suggest to it. We'd just like to suggest that might be a way of getting to where the author wants to get, okay, but not in a way that is overwhelming to the providers themselves.
Great. Thank you.
My name is Bianca Amon. I'm a daycare provider here on behalf of my colleagues statewide to oppose SB 792. There's never been an occupation in the U.S. that mandates vaccines without an exemption as a requirement for employment. All other adult vaccine mandates are optional and sponsored by the employer, including at Disneyland. In 792, the financial burden, adverse reactions, and any damage to herself or children are carried solely by the child care provider. Early childhood workers are a vulnerable group due to the lack of union representation, which is why California healthcare workers, though actively working with sick individuals, are entitled to and have successfully sued to maintain healthcare worker exemptions. I'm disappointed that Senator Mendoza has been unable to meet face-to-face with opposition groups and constituents to discuss the numerous issues of this bill, which include the unavailability of single antigen vaccines and the extreme requirement of obtaining a medical exemption for something as basic as lactation. Caregivers, often women in their childbearing years, will now be forced to educate their own doctors on the contraindications and disparity between vaccine inserts and the CDC recommendations. This, along with the newly created need for a physician to now issue a medical exemption for things as basic as pregnancy, pre-pregnancy, and lactation to maintain employment. 792 has the California legislature writing a prescription name brand prescription for name brand pharmaceutical drugs that have not been tested individually or collectively for their effect on pregnancy and fertility. This is verified in the current vaccine inserts your offices have been given. I'm extremely disappointed that the amendment suggestion of a mechanism for informed consent, a simple double-sided document outlining the possible contraindications, was rejected by the bill author and sponsor. I'm also disappointed that the request for the state to reimburse any out-of-pocket expense was rejected as well, placing the financial burden on women that are on the lower end of the pay scale. Also rejected was the request for a personal exemption for a caregiver eligible for a contraindication to use to avoid costly, time-consuming doctor visits. If the goal of this bill is to protect infants, then the state must do its due diligence to ensure that it also protects developing infants and those that are about to be conceived. Pharmaceutical companies have no liability for any damage or injury that may befall a caregiver or her developing child. Again, most do not have workers' compensation or health insurance. With these vaccine mandate bills, the benefits are concrete. However, the real human costs and implementation issues are more abstract. Before California becomes the most aggressive state in the U.S. with respect to vaccine mandates, I ask that you acknowledge that vaccine medicine is not yet an art form and contains hazards for some. I respectfully request that you oppose this bill without amendments.
All right, great. Thank you very much.
My name is Christina Hildebrand, and I'm speaking on behalf of A Voice for Choice. We also oppose this bill. We are open to a similar amendment that would post in a childcare facility that the staff are not fully up to date on these 3 vaccinations. We do feel that our babies and our children are clearly should be protected, but so should the employment of the workers that look after them. And we feel that this bill is not justified. There have been no known outbreaks of pertussis, measles. The flu vaccine has a personal exemption on this bill, but there have been no outbreaks of where childcare workers have transmitted those diseases. We also have no idea how many of our childcare workers are actually vaccinated or have natural immunity. Without that knowledge, we can't go ahead and mandate vaccinations because we just don't know what the landscape looks like out there. We would like to focus SB 792 on more of a bill that actually collects that data, and let's do that as a first step. And then if the immunization rates are low, let's educate and let's get those rates, try and get those rates up without mandating a law that forces vaccination on childcare workers without any other recourse. We will become the first state to mandate vaccines as a term of employment. There is one other state that does that, which is Texas. From a childcare perspective, Texas has a full personal and religious exemption for their childcare workers. Not even doctors and nurses in our state are forced to take vaccinations. They have a full medical and a full personal and religious belief exemption. The AMA states that in their code of ethics. SB 277, which many of you voted no on, took away our child's right to an education. SB 792 takes our childcare workers' right away from having an employment that many of them, this is the only employment that they have access to because they want to stay home with their own children and create daycare or childcare facilities in their homes to have other children come in and have an income. Having another form of employment where they would have to have their children in childcare would not be an option. The bottom line question is, without a real documented threat, should the government really have the authority to force a medical procedure on an adult and threaten their job when there is a risk? We know there is a risk from vaccinations to some people. Therefore, I ask for your no vote on this. We would take an amendment that would give a personal belief exemption for all 3 vaccines. There is currently one for the flu vaccine because a senator in a prior committee stated that he had a reaction to the flu vaccine, and so that exemption was given. So my question for you is, do we need a senator or an assembly member to come up and have a reaction to the Tdap or the MMR vaccine in order to get our exemptions? Is that a way for us to state whether an exemption should exist or not, a non-medical exemption? I ask for there to be a non-medical exemption. I ask for there to be more data collection behind this, so that we really know what the landscape is in our state before we start mandating vaccines and making that a criteria of employment. I did want to just address the pertussis issue that was brought up by the gentleman over here. The pertussis vaccine is known to be ineffective. 80 to 90% of people who have gotten pertussis in the past few years have been fully vaccinated. So the pertussis outbreaks in our state are not due to non-vaccination. They are due to the fact that the vaccination is not effective. So I just wanted to clarify that from that. But we do ask for a no vote, or at least a personal exemption to be added for all three.
Okay, thank you very much. Any additional opposition? Please come forward and state your name and your affiliations. Thank you.
Good afternoon. My name is Terry Rourke. I'm a native Californian and the surviving parent of a child who was injured by DPT in 1973. I represent the Californians for Vaccine Choice in alliance with the National Vaccine Information Center, and we ask for a no vote. We oppose any vaccine mandates that do not include personal belief exemptions. Thank you.
Thank you.
Dr. Mary Kelly Sutton, in practice in Fair Oaks, California, and I am in opposition to this bill unless there's significant amendments. Thank you.
Thank you.
Hi, my name is Kelly Smith from Granite Bay, also from California Coalition for Health Choice, in opposition. Thank you.
Jennifer Alexic, psychotherapist in Sacramento County. I work with people who've experienced iatrogenic injury. Iatrogenic injury is very real. I'm the mother of a son who passed away 12 hours after vaccination. His autopsy ruled his death as severe brain hemorrhaging due to his vaccination. All medications, psychotropics, and vaccinations come with risk. Unless you're willing to mandate preventative testing, there was no way to know who is susceptible to injury until it is too late. Please oppose this bill.
Thank you.
My name is Jordan Cota from Rockland, California. I'm a mother of 5 and California correctional teacher. I also have worked in the daycare system, and I ask that you oppose this bill unless it's amended to include a personal belief exemption.
Thank you.
Hi, my name is Rochelle Emery. I'm a former educator, former nanny, and now stay-at-home mother, and I oppose any mandatory vaccinations without a personal belief exemption for many reasons, risk, and or religious. Thank you.
Thank you.
My name is Shanda Murray. I'm a parent and a teacher, and I strongly oppose SB 792.
Thank you.
Hi, my name is Hannah Matthews, and I oppose SB 792 as well, just from a human rights perspective and also from informed medical consent perspective. I don't think we should force people to get vaccinated. My son got seizures after the last round of vaccinations that he had, so I just think it should be a choice. Thank you.
Thank you.
Hi, my name is Jude Tovat. I am the mother of 4, including 1 adult child who is a daycare worker in the state, and I encourage you to vote no on SB 792.
Thank you.
My name is Helen Tam. I'm a parent, and I oppose this bill because I support everybody's right to choose when it comes to a procedure that has risks. Thank you.
Thank you.
Hi, my name is Allison Rutherford. I'm from Miss Allison's preschool in Vacaville. Been doing preschool in my family child care home environment for 30 years, and I oppose this bill.
Thank you.
Hi, my name is Lisa Bakshi. I am a public school teacher with a master's in education. I also am a board member at my children's preschool, and I am also the mother of a vaccine-injured child. I oppose SB 792 unless it is amended to include a personal belief exemption. Thank you.
Right, great. Thank you very much. That concludes the witnesses' testimony. I'm open for any questions by members. Vice Chair.
Sure, just a few questions, and we've been getting lots of calls from the district.
Most of them are in opposition to this, and I just want to make sure that it's clear. I'm not anti-vaccine in any way. In fact, I think from what we've seen, vaccines have been really a wonder of science in making sure that to stop the spread of any diseases. But I am in looking over the analysis here, and I'm trying to figure out what are we trying to solve, because I have heard the one instance of the 12 children in the one daycare center, but was that do we know for sure that that was a daycare worker that was the one that's brought the disease? What's the problem we're trying to solve?
Well, just I want to bring the sponsor of the bills up to the front as well, the healthcare officer. But let me just answer that. What we're trying to do is we're trying to provide a community of immunity. These kids that are under 5 years old cannot be vaccinated because they're too young. They have very minor vaccines when they're growing up, but under 5, so they're not as potent or as strong to protect them. So we're trying to create a community that means everybody around them to be vaccinated, to be able, so that those children will not get any kind of diseases. So by having the child care providers or the daycare center workers be vaccinated, keep in mind that these individuals every 2 years have to go get a TB test. They go and they get injected with a TB test, and then they come back 3 days and have to check it. They don't mind. They don't seem to mind that so much. This is a one-time shot. If they get an MMR, they get any pertussis, that's from then on. So it's not like they're going to be coming every 2 years to do that. And why we try to do it, again, protect the children who, because they're under 5, can't protect themselves. This is different from the other bill, which actually protected K-12 students. So it's a little bit different. We're protecting the kids that cannot get any kind of vaccines. And now I'll let the health officers, if they could come to the front. Or here, we have a doctor here that can actually expand it.
You had asked me about the 12 infants became sick. So what we're trying to do is basically, because the infants cannot get immunized, we want to develop or have an area situated so that they're not exposed to that. So if that makes any sense, it's not about who actually contracted it. It's about making sure that that environment is safe as a whole. So by making sure that the child care providers are immunized, that way it can prevent the sickness from happening.
But so are there any instances at all in which we know for sure that it was a daycare worker that brought the disease and spread the disease in any daycare facility? Is there any instance of that at all?
They have brought a couple incidents to our attention that we're trying to look into. For one recent in Santa Cruz County, some in Yolo, and one in Santa Monica daycare center. I think it was Santa Monica High School that was also that came to our attention.
And what happened there?
The employees that were actually sick had to be sent home till they get to the.
And was there a spread in that daycare center from that employee that was?
I want to say yes to one of the children, but I don't. We're trying to get more details on it. It's been kind of hard.
Sure,
but there is a need. Obviously, there is a need.
I just wanted to respond to the comment that under 5-year-olds are not fully vaccinated. Most children up until the age of 2 have received at least one dose of every vaccine, including the MMR and the DTaP. They've actually received multiple doses of the DTaP. The second MMR vaccine isn't given until 4 to 6 years old when they enter kindergarten. So the fact that saying that under 5-year-olds are not vaccinated is actually, if you look at the vaccine schedule, children get 49 doses of vaccines up until the age of 5. So most of them are vaccinated to some extent. The other thing that I would say is the TB test is a blood draw. It is not injecting something into your body. It is the quantiferin is. And then I would also say that when you look at a childcare center, the number of people that come in and out of childcare centers who will not be covered by this bill, including parents who come twice a day, including the licensees, the administrators who are checking the licensing and other things, there is no mandate for them. So forcing this on the daycare and the childcare worker that is actually in the classroom or in the home is, we're not covering a whole population, aside from the fact that these children are out in society the rest of the time while they're not in daycare, which also doesn't, they're not living in a bubble.
Okay, thank you. And so how many...
I would like to also respond to a couple of things. Firstly, it has to be understood that, in fact, there are many under-immunized or non-immunized children who are under 5. Especially, for example, you're not going to be vaccinated against measles until you're 1 year of age. You're not going to be starting your pertussis DPT series until you are 2 months of age. And in daycare centers, you are handling children of these ages and younger. The other thing I want to mention, again, just to reinforce what the Senator has said, is the concept of cocooning, that we're trying to create, if you will, folks who are immunized around them. That's why also we, for example, recommend in the last trimester of pregnancy even to give pertussis vaccine to women so that that antibody passes over to the child to protect the child, but at the same time gives that mother then protection for the child herself. So I think that that's really important to realize that some of these vaccines, in fact, like influenza, are recommended in pregnancy because of the fact that the severity of complications of influenza and even death in influenza is much higher for pregnant women. The issue is, in fact, for other vaccines that, for example, pertussis, the Advisory Committee for Immunization Practices has documented thousands of women who have received this vaccine in pregnancy, and there's been no untoward events.
One of the things, of course, since we don't have data, that's correct. So we don't know how many of the daycare workers have been vaccinated and how many haven't. Do we know how many daycare workers there are in California that would be subject to this? Do we know what that number is?
I saw the number somewhere. I know there's a certain number of licensed daycare facilities and child care centers. I saw the number somewhere. I'll see if we could get to it in a few minutes.
We do know for licensing.
Oh, it's 35,000.
There are 32,000 licensed family daycare providers, and they're divided between what we call large homes and small homes. And in large homes, you're required to have an employee if you have above 8 children. Yeah. So I can't remember exactly how many, but so maybe there are 35,000 or so that are in licensed family child care. How many are in child care centers? I can't speak to. I don't know.
Okay, and why are daycare workers different than teachers or different than nurses? I understand, according to the California Hospital Association, that hospitals require, in fact, even a family friend of mine who's a labor and delivery nurse, I called and said, have you been vaccinated? Yes, I was required when in nursing school. Why? Well, because I went to, we were going to be working in the hospital, and we were required to be vaccinated before we went to work in the hospital. But that was a requirement by the hospital, not the school. And so the question is there any other, as a matter of state law, are there any other requirements, any other occupations in which we require those workers to be vaccinated, those that spend a lot of time with children? And why did we decide for daycare workers? Why them?
And I'll go back again. For me, the children that were not being paid attention to are the kids that were 5 and under. Just because they're not fully immunized, it makes them more susceptible. Some of the kids might have medical condition that prevents them from getting any kind of vaccine. So that means that the people around them need to be protected. When you're talking about K to 12, those kids are much older. They're able to get the full vaccinations, and there's such larger numbers. They're the ones that probably need to be vaccinated themselves more so than the teachers. The teachers might be already vaccinated. Most people are, but when their kids are under 5 years old, they can't. Or fully people. That's why we're targeting them. As far as the health facilities and why they're not, some are required, some not. Maybe I'm going to let the doctor speak to that.
I think a couple of things. First of all, for healthcare settings, I mentioned briefly in my testimony, the healthcare setting is just so much different than a tried care setting, where, again, you will have infection control procedures, rigorous hand washing, masking if necessary, things like this that are just not occurring, nor is it practical to have in a daycare setting environment. So that's, again, the reason why we want to make sure that the workers around these infants have that protection, because they're not using other medical precautions.
Yeah.
I would argue that point. Child care providers are required to attend a health and safety class, which includes the procedure of wearing gloves and handling bodily fluids. Hand washing practices are actively worked with. It's also important to note that licensing is fully aware which child care providers do and don't work with infants. So one amendment that was put forward early on is to possibly have this bill apply to, or at least look at, people who actually care with infants, because many daycare providers or preschool teachers like myself don't work with infants. And most of the infants that we receive are over 12 weeks because parents have a paid family leave plan that allow them to stay home with their child. So by the time we receive most infants at 12 weeks, for those of us that do work with infants, the good majority of them have received their vaccinations. And again, by age 6, they'll have received 47 under SB 277.
One more question, Mr. Chair, if that's okay. I think it's one of those, this is one of those cases where I'm not sure that government needs to engage. I think you could make the argument, even with SB 277, even though I was on the opposed side of that bill. Why not with this, when we're talking about an occupation, you're talking about facilities that are licensed, why can't we notice, why can't we make sure that the daycare facilities that their employees are vaccinated, that's noticed? And also thinking that the vast majority of these daycare workers are probably already vaccinated. Why wouldn't we just have a notice requirement like the hospitals do, instead of, or requirement, or have the employer require that their employees at those facilities be vaccinated, or do some sort of notice requirement? Why not? Why do we have to force these daycare workers to be vaccinated?
I want to say force, but we're looking, again, going back to the where the bill is written is to protect the kids that are under 5 years old. We just notice it or label them and say this person vaccinated, this one's not. We began to put a letter grade on their doorstep, said this facility is not a good facility to leave your kid in. We don't want to go that route. It still doesn't protect the kids that are in that facility. We want to protect the kids that are under 5 years old. By labeling the facility or the people that are not immunized, it doesn't solve or protect the kids that are actually in those facilities.
And Mr. Mason, if they'd had immunizations and vaccination, then they would not have to be revaccinated for measles or pertussis.
But even here at this table, we had somebody who their facilities, all their daycare workers are required to be vaccinated, and we've got another daycare facility that's not necessarily the case. And so I'm wondering if maybe disclosure, notification is the answer, and not the heavy hand of government.
Well, the kindergarten is an example that it can be done, and it has been done. So why is there so much resistance for individuals that are just there? And this is where I think we get to the point that we just have to agree to disagree. If you're anti-vaccines, that's fine. If you don't want the vaccine, that's great. What we're looking at for the greater good, we're looking for the kids that can't protect themselves, that are under 5 years old. That's what we're looking at. And some of the same individuals that have been here, they're the same individuals that have continued to oppose 277. Now they're on this. I understand where they come from. That's their philosophical belief. I understand that. We're looking out for the best interest of the kids that are under 5 years that cannot be fully vaccinated.
Thank you, Chair.
Thank you. Any additional questions? I just wanted to thank senators that we worked over the weekend to resolve some of the amendment. And thank you very much for accepting the amendment not to discriminalize those people that not taking the vaccine. Yeah. And I understand that was your consistent with your intent since the beginning. So thank you very much. And I imagine most providers and employees that would be affected by this bill are already immunized. So, and I know this bill is about keeping our young children safe, and therefore I will be supporting this bill. So I will ask Madam Secretary. Oh, I'm sorry. We need a motion. We'll have a motion, and we'll have a second. And Senator, would you like to close?
Mr. Chair, I just want to thank your committee for working really close with us. I appreciate all the hard work you put in this measure and others, and thank the members again for your time. Appreciate it.
Right,
I respectfully ask for a vote.
Okay, thank you.
SB 792 by Senator Mendoza. The action would be due pass as amended to the Appropriations Committee. Chu?
Aye.
Chu, aye. Mays?
No.
Mays, no. Calderon? Aye. Calderon, aye. Lopez? Mainshine? Stone? Thurmond? Aye. Thurmond, aye. The bill has 3 votes. It needs 1 more.
All right, this bill be on call.
Thank you,
very
Mr.
much.
Chair. Appreciate your time.